One second, please. Ratios of arterial oxygen partial pressure to fractional inspired oxygen in a normal person is ranges between 400 to 500, but in these patients, they all measured at under 300 points. I'm moving between screens here, guys, so just bear with me. So I'm going to dive into the results. Application of the asymmetrical interface resulted in a negative 13.5% change in minute ventilation at a flow rate of 40 liters per minute, and a negative 19.6% change at 60 liters per minute that occurred despite no change in carbon dioxide values. Let's talk a bit now about how the study was actually conducted. So the study protocol consisted of application of the asymmetrical interface and the conventional interface in a randomized sequence for 30 minutes each. The size of the conventional interface was the one in place for clinical use at study enrollment. The asymmetrical interface was sized identically to the conventional interface in place at enrollment, either large or medium size for both. No instructions were provided to patients regarding mouth opening during breathing. Now, each interface was provided at a flow rate of 40 liters per minute for 15 minutes, followed by a flow rate of 60 liters per minute for 15 minutes. 4 total steps with randomization of cannula type. An oxygen saturation of 92 to 96% was maintained throughout the study by adjusting the set fractional inspired oxygen rate. In the last 3 to 5 minutes of each step, investigators recorded hemodynamic and respiratory parameters, PES and EIT data. They assessed dyspnea and obtained arterial blood gas analyses in patients with an arterial cannula. Tidal volume was estimated from the tidal change in impedance using a conversion factor. The primary endpoint was the change in minute ventilation in patients supported with the asymmetrical cannula interface compared to the standard interface at each flow rate. Secondary endpoints included the impact on work of breathing, quantified as a simplified inspiratory pressure time product per minute, calculated from the esophageal pressure waveform, and the following physiological parameters chosen to identify potential mechanisms explaining the effects of the asymmetrical interface, including gas exchange, lung mechanics, and indicators of respiratory drive. They investigated whether the asymmetrical cannula had any effect on hemodynamics by evaluating systolic blood pressure, mean arterial blood pressure, and heart rate. All right, so that is how the study was conducted. I'm reviewing the results really fast to see if I want to pull the results from the abstract so as not to have to sort through. Yeah, there's lots of tables and charts, and if this study really interests you, I'm going to share it in the discussion section so you can look it up for yourself. Full text is available for free, but I don't want to spend too much time on camera diving through charts and tables, so I'm going to pull the relevant result of the study from the abstract at this point. So application of the asymmetrical interface lowered the inspiratory esophageal pressure time product from 163 to 140 centimeters of water per minute at a flow rate of 40 liters per minute, and from 142 to 117 centimeters of water per minute at a flow rate of 60 liters per minute. The asymmetrical cannula did not have any impact on oxygenation, the dorsal fraction of ventilation, dynamic lung compliance, or end expiratory lung impedance, suggesting no major effects on positive end expiratory pressure. To conclude, researchers state that an asymmetrical high-flow nasal cannula interface reduces minute ventilation and work of breathing in patients with mild to moderate hypoxemic respiratory failure supported with a conventional interface. And this appears to be primarily driven by increased ventilatory efficiency due to enhanced carbon dioxide clearance from the upper airway. So I hope my sharing this information helps you as an allied clinical professional to understand the primary differences in efficacy between the use of an asymmetrical high-flow nasal cannula and a traditional one, and at what rate they work better, because they seem to have better use at a flow rate of 60 liters per minute. Okay, so thanks for watching. Like, share, subscribe. Liking my videos allows other viewers to for the YouTube algorithm to allow other viewers to find my channel. I'm constantly sharing new information here. Most of my channel is actually dedicated to sharing clinical trials about nutraceuticals and over-the-counter products that are useful for the amelioration of various complaints in the body and disease processes. So even if this may not be particularly applicable to you or your life, it may be what I come up with later on or in previous videos you may find to be not just applicable to your life, but to persons you know, persons, your loved ones, and so on. Additionally, I'm closing out my videos with an ad to my sportswear line. I have had pretty much very high acclaim in high fashion editorial magazines such as Elle, Vulcan, L'Officiel, and so on. My sportswear has done very well in the high fashion arena, and right now I'm just trying to figure out what's the best way to reach the general public, and still the general public who can afford my designs. My fabrics are not Asian imports. They are in fact from Europe, Eastern Europe. They're very high-end fabrics. The stitching is very well done, and I do all of the graphic work. So please have a look. I do my manufacturer mails everything out worldwide, so there's probably no country to which we can't send off an order. So please give us a try, give me a try, and I appreciate your support. Do please comment as well. Thanks for watching, and have a great day until next time. Bye bye.